Now, for senior high schools with COVID-19 cases, their expectation of the much-awaited vacation after 6 weeks in school will be delayed. It is a precautionary measure taken by the Ghana Health Service in collaboration with the Ghana Education Service to avoid students carrying home the coronavirus. Director General of the Ghana Health Service, Dr. Patrick Aboagye, hinted this at the Information Ministry's presser earlier today.
The goal track of the SHS2 are about completing today or tomorrow. The arrangement for discharge are in 3 categories, and there will be a press release on that. The schools that have not reported any case, it means that those students can vacate and go home. The second category will be a school that has had a case, but if in the last 2 weeks there will be no case, they can also advise that they can also vacate and go home. The third group will be any school that has had any positive case in the last 2 weeks. The assessment will be done to identify those who are contacts, and if any of them is in that class, their vacation will be delayed whilst we do an assessment and observation, after which they will be asked to go home. And all parents concerned will be informed as soon as such a thing appears.
Meanwhile, 7 new COVID-19 deaths have been recorded in Greater Accra and Ashanti regions, bringing the national total to 182. 5 males and 2 females died from complications, including anemia, kidney failure, and hypertension.
Show you the number of deaths per day, and you can see it just aligns with the June one. But currently, the reported number of deaths have significantly come down, and we hope this trend will continue as we go on. We added about 7 more deaths in the last update, and they've come from mainly from 5 from Ashanti and 2 from Greater Accra. Majority of them were males, 5 males, 2 females, aged between 33 to 60 years of age. About 4 of them, we do not have any known comorbidity. We are not saying no comorbidity, no known comorbidity, but that's what happened. But the rest were anemia with renal, kidney failure, hypertension, and another one with diabetes and hypertension. And these are the ones that are reported deaths. These are not very recent deaths, but these are when we now finish the audits and be able to add them.
Dr. Patrick Aboagye there. But the good news is active cases continue to decline. Dr. Aboagye says as of July 28, active cases were 3,223, whilst 33,096 had recovered. He attributes the decline to improved measures adopted by the officials to beat down the virus.
The breakdown of the active cases, as you can see, Ahafo has 94. Ashanti has 518 active cases. Bono has 18. Bono is 93. Central region has 193 cases. Eastern has 49. Greater Accra, for the first time, I dropped below 2,000. They are doing 1,900 active cases. Northeast, no active case. Northern region has 7 active cases. OT has 52 active cases. Savannah has 1. Upper East has no active case. Upper West 13 active cases. Volta has 116. Western has 164, with Western North having 5 active cases. And the charts, the next chart, the graph will just show you exactly where they are. The graph showing now also shows you, the graph on the right tells you all the districts that have ever had a case. And you can see that in the last few current reports of which about 2 weeks over, these are the districts that have reported a case. You can see that a significant number of our districts have not reported a case in this period. The hotspots continue to remain in the same areas of Greater Accra and Ashanti region, and you can see the Accra metros, Kumasi Metro, etc., that continue to show. Next slide, please. That continue to show the number. But we're still having a few Ningo parameters that are reporting relatively very low cases. Normally, the active cases, we present them weekly because, I mean, as I'm speaking now, someone is either being discharged, among others. And so this is not a very clear slide, but as at 24th of July, we'll be doing that weekly. Next week, we'll give you an update on active cases, exactly where they are. You could see that as at that time, we had about 3,560 and 2,731 were on home care because they met the criteria. They didn't have any symptoms, and they did also not have any comorbidity that allowed us to that we should put them in. 360 of them were, that's accounting for about 10.7%, are in isolation. 263, 7.9% are in our treatment centers. Next week, we'll give you an update because we want to do a weekly thing to see, and that's an important figure to show us whether our system is choked, whether it's a number that the health system can contain. And I believe that, and I'm sure you believe that this is a number that the health system can contain, because even